Cloudcast Media. Drew Schlosberg Spotlight on the Community Show, amplifying the voices of social impact organizations, entrepreneurs, local nonprofits, and other community champions who shape the culture, creativity, and connectivity of San Diego. Brought to you by Mission Fed Credit Union, bringing good things to San Diego for over 60 years. Learn more about what is good for you and good for all by visiting www.missionfed.com.
I'm Drew Schlosberg of Cloudcast Media, and we are so pleased to have in the studio with us Wyatt Hinshaw. He's the founder and CEO of Fundamental Health. How you doing there, Wyatt?
I'm doing pretty good. How about you, Drew?
I'm doing fine. Thanks so much for coming in. We're going to be joined by my longtime friend, often co-host, Cool Cat, and everything else that goes along with just great things that are being done in San Diego, and that's Neville Villamoria. He's the Senior VP at Mission Fed Credit Union. And as always, Neville, we're just so pleased when you bring in just some, cool folks like Wyatt to talk about the great things they're doing in our community.
Thanks, Drew. It's my pleasure to be with you again.
Always appreciate that. And we're happy to say thanks to somebody that Neville introduced us to. My co-host in this program is Brandon Joe. He's the co-founder and CEO of Treasure Hacks and is now an associate producer of my Spotlight on the Community show. How you doing, Brandon?
I'm doing good. It's always a good day when I'm with you.
Well, listen, you're very, very kind on that. I know you have a question for Wyatt right out of the gate.
Yeah. So just like we always start, just wanted to ask a little bit about your organization, and that is about the mission.
Yeah. So at Fundamental Health, we believe access to mental health care is a fundamental right. And so we endeavor to break down financial barriers, cost being the number one barrier to mental health services, and make sure that quality mental health care is accessible to all.
As Neville knows, we almost every week are talking about the mental health crisis in our country, world, solar system. I don't know, things we don't even know about. And we were just mentioning it in an earlier edition today. And it is real. It is here. How long have you been involved with mental health?
Well, I've been a patient for 14 years.
Okay.
I'm actually not a medical professional. I'm not a mental health professional, but I have shared experience, and I believe that's what I bring to the table.
Yeah, that's really important. Neville, we talk about this all the time, and very laser beamed on it. You personally are, and of course, Mission Fed is, the importance of demystifying mental health, breaking the barriers that there's a stigma. I hope I'm alive when that actually happens. Maybe I'm being a Pollyanna, but we need to hope on that. Talk about it.
Well, absolutely. Wyatt and I were talking about that before the show, how it's okay to not be okay and how we need to treat mental health the same way you treat physical health. And I was using the example of if I was, had to go into my HR department and said, I'm going to have to be in late once every 2 weeks because I'm having chemo. No one's going to give me any grief.
Right.
But if I say I'm going to be late once every 2 weeks and they talk to my psychiatrist or psychologist, they might look at me askance and there's some judgment that comes along with that. And I think that's what we've got to debunk is treat it just like anything else and destigmatize it and make it okay to not be okay.
Well, and I think we've made inroads, of course, in this, but not as fast as I'd like to see it, and not as deep as I'd like to see it. And it's all about communication. We know that, and that's what Neville's all about. Brandon, now that he's joined what we've done here, and of course his Treasure Hacks business is a little about that too. We can't announce loud from the rooftops of how important it is to address this head on, to help people with this head on, and to not look like it's any fault of the person, so to speak. Right. And you talk a little bit about that if you can, Wyatt.
Yeah, well, from my own personal experience, I've felt how difficult it is to kind of talk about my own mental health. Not to toot my own horn, but I think it took a lot of courage to kind of raise
100%.
my hand and ask for help 14 years ago. Now, our organization is more about kind of connecting people directly with services,
right.
But there's always advocacy work to be done. There's always destigmatization work to be done. So on our website, you'll see my story. I share it with everybody. And we also want to support other organizations or individuals that might be working at a policy level or with advocacy, so that we provide the direct services, they destigmatize things, and together we just help those struggling with their mental health.
Yeah, we've had some just great guests on the show. We've been doing this for 18 years now. And recently we had a Palomar Health Group on. They were in the mental health area, the folks that were on. And I shouldn't be surprised by this. We have a shortage of everything in this world, for God's sake. But they were talking about, and maybe you can address this a little bit, Wyatt, and then you can jump on it as well, Neville. The shortage of mental health professionals is staggering. And I think they were saying that at one point it would be maybe up to 18,000 positions that we're going to be short of in the not too distant future. Talk about that.
Yeah, I mean, you're right. There's not enough mental health professionals out there. I think we need better training programs. I think the destigmatization, the advocacy efforts will only help encourage people into this profession. And, I almost take a slightly different thought approach to this issue. Yes, there's not enough numbers of mental health professionals, but it's also a capacity issue. The mental health professionals that are out there today, the therapists, the psychiatrists, there's a lot of paperwork that they need to do. We work with a clinical consultant. She sees patients Monday through Thursday and has to take Friday off to do paperwork, do the administrative stuff. And so what if we could give her Friday back? That's a 20% increase in capacity right there. So yes, we need more professionals, but we also need to make their job a little bit easier and pay them better.
Amen to both of that. Neville, what do you think about that?
Well, there's so much friction in the system. It starts with the individual not being comfortable to ask for help. Once you take that brave step and get vulnerable, and then you try to get the help, you'll be surprised how long it'll take you to either find the right psychologist or get the right person. And then you find somebody and they're like, hey, back to this whole friction in the system, I only take cash. I'm not taking insurance. Why? Because it's a royal pain in the to have to even navigate it.
Right.
So even the ones, and the best ones, can command that because they're good at what they do. So this whole issue of access is super critical. It's not just it's both a supply and demand problem.
Yeah, without question. We're chatting with Wyatt Hinshaw. He's the founder and CEO of Fundamental Health, joined by his friend, my colleague too, Neville Villamoria, Senior VP of Mission Fed Credit Union. I'm Drew Schlosberg, as you're listening to another edition of Drew Schlosberg Spotlight on the Community Show. We're the nation's longest-running community podcast, now in our 18th year, brought to you by Mission Fed Credit Union, this beautiful Mission Fed studio in Scripps Ranch, and Mission Fed for more than 6 decades, just doing great things for us folk living in San Diego County, joined by my co-host, Brandon Joe. He is a producer of our Spotlight show and the co-founder of Treasure Hacks. Yes.
I just have a quick question because based off of my experience and talking to a lot of my friends, of course, it's kind of a two-parter, because the first step of acknowledging that you have a problem, like this is something that I always struggled with as well, because back when I was in high school, I experienced this for 2 years. I told my friends in like a sleepover and I got complete silence, yes. No answer. And maybe one of them said, that sucks. And I'd never asked for help again. And I just had to figure it out myself. So that's like part of the stigmatization. So how do you make sure that you create the correct space to reach out for help is the first part of this question.
Right. Well, let me first say, I'm sorry you had that experience. That must have been very tough, gaining the courage to say something and then having that feedback from your peers. But I think it's about creating new channels or avenues for people to reach out. So, at Fundamental Health, we make it very easy to get a hold of us. So if somebody has questions or somebody's looking for support, we offer that channel. But I think, it can start in the schools, kind of educating children around emotions, around mental health, and then kind of giving them the options as they go forward of, hey, if you're struggling, if you want to talk to somebody about this, there's teachers, there's parents. And then by kind of educating the students, now you have peers that you can go to as well and share your experience.
Yeah, and it kind of comes from a person-to-person sort of experience rather than a professional-to-person, because that's what we really need is that support from our peers.
Yes.
Because everyone goes through this to some degree. It's just a matter of how you are able to handle it and how well your peers are able to step in and do the right thing to just listen. It really is that first step.
Absolutely. And if I could say one more thing, over the course of my mental health journey, I've actually done a lot of group therapy. And so you're in a room with your peers. And yes, one-on-one with a mental health professional is very helpful for me. But having that room full of my peers that can kind of reflect back to me, share their own experience, share some tips and tricks on how they deal with that experience, peer support is critical to everybody's mental health journey.
That's powerful. And I'd have to wonder if that is a potential thing that can help alleviate the lack of professionals in the area, is having more of these group sessions, to have more of your peers to support you, because that was one of the feelings back in that 2 years was, I'm alone. I acknowledge, at that point I understood that there was other people that felt the same way, but it's very different when you're in a room with other people that feel the same way. And that can be amazing.
Yes.
And just to move on to the second part of this question before it drags on, another one of the things that my friends have experienced is once they get the courage, they go out to a professional and they're simply not the right person to help them with their problems. So I'm just wondering, how does fundamental health help to get people to the right therapist, to the right person that can understand that their problems, to listen to them? Because every problem is complicated, and the more closely that the therapist has worked with someone of that problem, the more success, at least, I've seen.
Yes, no, that's absolutely an issue. You can go into psychology today and have lists of hundreds of psychologists to reach out to, but where do you go? Who's the right fit for you? If you got good insurance, they'll send you a list of 100 providers, and it's like, where do I go? Who's the right one for me? So the approach that we take at Fundamental Health, which is adopted from my own personal journey in mental health, is we've built a team of care coordinators. These are individuals that will understand each complicated case, each complicated mental health issue, and then go out into our network of providers and find the right provider for that individual. It's very important to have an accurate diagnosis because there are very specialized forms of therapy and mental health treatment today. It's not one size fit all for therapy. And so our care coordination team really takes time to get to know each individual we serve and make sure that we're connecting them with the best fit provider.
When we come back from break, I want to talk more about that. Neville, I know you have some thoughts when it talks about, with peers and so forth. And, I know you're very laser beamed in this topic as well. When we also come back, we'll talk about, donors and all that business, partners and providers as well. Wyatt, when we return with Wyatt Hinshaw, founder and CEO of Fundamental Health. I'm Drew Schlosberg of Cloudcast Media. Listen to another edition of Drew Schlosberg Spotlight on the Community Show, brought to you by Mission Fed Credit Union, joined by Neville Villamoria, Senior VP at Mission Fed Credit Union, and my co-host and producer of the Spotlight Show, Brandon Joe. We will be right back.
When you do your banking with Mission Fed, you get great rates on auto and home loans. That's good for you, but something good also happens for a lot of other people. We're not for profit, so we put money back into the community to help lots of great nonprofits to keep San Diego strong. So you're not just getting something good, you're doing something good. Come to Mission Fed. It's banking that's good for all.
Brand amplification is the DNA of Cloudcast Media, and our code is the powerful blending of sound, voice, and storytelling to lift local brands and their communities. Whether it is our Brandcast, Schoolcast, or Causecast platforms, the unifying ethos is all about this community, the one you call home. If you dare to dream and want to explore the brand amplification of Cloudcast, a national leader in local podcasting and other Winfluence strategies, please visit us at cloudcast.us.
I'm Drew Schlosberg, Cloudcast Media. You're listening to another edition of Drew Schlosberg's Spotlight on the Community Show. We are the nation's longest community podcast, now in our 18th year, brought to you by Mission Fed Credit Union. For more than 6 decades, been doing great things for those living in San Diego County. Joined today by Wyatt Hinshaw. He's the founder and CEO of Fundamental Health. Joined by Neville Villamoria, my often co-host. He's the Senior VP of Mission Fed Credit Union. And Brandon Joe, the founder and CEO of Treasure Hacks and a new producer of the Spotlight Show. Neville, I know you got some thoughts on, we were talking about peers and so forth and all the mental health stuff going on.
Yeah, just in the first part of the show when Brandon was being vulnerable in sharing his experience, I just want us to reflect on how gracefully Wyatt first honored that and said, I'm sorry that happened, and then answered the question that Brandon brought up, which really speaks to the importance of social connection and peer learning, that we learn more from our peers and sometimes from the experts. So some people could give Wyatt grief, like, hey, you're not a trained medical person, what the heck you're doing trying to do this up? But he's actually turning his stumbling blocks into stepping stones. He's turning his lived experience into other people can learn from his experience and not have as difficult a time. So I just want to first honor and dignify the courage and the commitment you're investing in making humanity a little more human. So that'd be the first part. And then the peer learning piece, I think, is really critical. We do this in education all the time, right?
Right.
It's not it's what happens co-curricular or
100%.
From your peers can be as powerful as anything else, and who they are speaks so loudly you can't hear what they're saying. So the expert doesn't always have the right answer or doesn't need to. If the expert can put you in the right construct or context, then you can nurture a safe, positive, heliotropic, life-giving experience, and you can get the heck out of the way.
Well, as usual, you're spot on that, and I want to address that as well. And I will argue the fact that Wyatt is more of an expert than maybe some of the experts, and that's not to debunk some of the great schooling they have done, but you lived through it, so you know what it's about. And it brings up my beloved father, passed away many, many years ago, was one of the top physicians in Los Angeles. But his thing was the patient knows more about the body than almost anyone does. For God's sake, I'm going to listen to the patient. If they say they're hurting somewhere and I can't find it, I'm going to trust the patient. And I think that's what we see these days. Those doctors, whether it's a mental health doctor, whether it's a physical doctor, that actually trust the patient. This is how the patient is feeling. Can you address how the person is feeling and not how you're diagnosing it? If it's not that, anyway, I'm very bullish when it comes to that aspect of it. Listen, you cannot run organizations without money. Donors are important. They turn lights on. Yes, there's still volunteers and there's other things and all that, but talk about how important donations are, right?
Oh, it's critical. So I'm happy to report that we've kind of proved out our care model. We started working with clients last month, and now we're ahead of schedule working with 8 clients. So we've proven the model. Now we need to scale it. And so to do that, we need to put the systems and software in place and build a team that allows us to take this proven model and just spread it out to more and more people in the San Diego community. And to do that, to scale, to build a team takes money. So donors, supporters are absolutely critical at this stage.
Right, exactly. Brandon?
And in addition to that, another way that is necessary to grow is to have these partners in the community that you mentioned. So talk about it.
Just as donors and supporters are critical, our partners are too. So we've formed partnerships very early on, and they're kind of our sources of client referrals at this point. Rather than opening the floodgates and putting out social media, hey, come to us, we're working with our partners who support similar populations as ours, but in different ways. So I'm going to plug real quick ESCO Kiddos, and I think they'll be very happy for me plugging them. But they support children of immigrant families around advocacy, abuse, education, but they don't have that mental health component. So they reached out to us and said, hey, can you help us support our clients? And we said, absolutely. So we signed an MOU. They've referred over 4 clients to us already. Might not sound a lot, but again, we just started working with clients last month. And so by them referring clients to us, we can help them on the mental health support or mental health side of things. And ESCO Kiddos can continue helping them around advocacy, education, all those other things. So 1 + 1 = 3. We can now take a holistic approach to supporting these shared clients.
Yeah, that's terrific. Neville, your thoughts on that?
Well, I was reflecting on your not rant, but passion around the commitment.
It was a rant.
No, that the patient knows themselves and so the individual and trusting in the individual. And I was just reflecting on my comment about friction in the system, and that the DSM-5 or whatever the most recent diagnostic statistical manual is. It's really about managing costs. It's not about creating care. They want to label you so they can put you in a bucket so then they can tell you what medicine you can or cannot have, so that the whole system perpetuates. We need a better intervention and a more humanistic way to discern and personalize the experience. And it should all come from a place of care. There's a difference between a clinician and a healer. Clinicians can, now you can have Chat GPT and AI can diagnose you to some degree, and in many cases better than the technocrat. But that human healing component, it's going to take a lot of compute power and heart power, which is not just bits and bytes, to transform that. So therein lies another both problem and opportunity, is how do we bring more humanness and health to the healing professions?
Well, listen, we've talked about this quite a bit, Neville, you throughout the years. I think you've almost been on my show all 18 years, if I'm not mistaken. And we talk about there's so many simple things to do. And just one of them is being kind and showing a little empathy. Try doing that and seeing how you can reduce some of the mental health issues with folks. Almost what Brandon's talking about, someone listening and someone, having a place to go to. Yeah, that would have turned down the temperature quite a bit. There are things everybody can do. It doesn't cost anything at all in that area. So let me ask you this. We always save this part of the show for our guests to say, what can our listeners do to support your efforts, Wyatt?
Yeah, well, thanks for asking the question. So as we mentioned earlier, donor supporters are critical at this stage for us.
Right.
We've proven out the care model, and we know where we want to go 6 months, a year, 2 years from now. It's going to take some money to get there. So we hope that people listening to this show, hearing about our very, our mission that comes from a truly good place, that they would want to support us. Additionally, we talked about partnerships earlier. So we have a lot of partnerships in the works. But again, we're looking for those partners that together, between us or between Fundamental Health and themselves, we can take kind of a holistic approach to people's care. For example, if you're dealing with somebody that's struggling with homelessness, if you give them the best possible mental health care in the world, but they don't have a roof to put over their head at the end of the night, you're spinning your wheels. So partners are absolutely key to what we're doing. And, for the people out there that are struggling with their mental health, that don't know where to go, we're an open door. So I would encourage anybody to go to our website, www.fundamental.health. There's no .org or .com, it's .health. And we'd love to start the conversation with you. And then, as I mentioned briefly earlier, we're building out a network of quality mental health providers. I kind of think of this as our secret sauce. And so if you're a provider out there in the community, if you're wanting to support those individuals who traditionally have not been able to access your level of care, then, come to our website. We'd love to start the conversation with you as well and add you to our network of providers so we can connect you with those individuals in the community that deserve your care.
No, that is beautifully stated. Neville, any final comments?
Well, I want to thank Wyatt for his courage and commitment. to think about this more holistically, a systems thinking approach. So it's place-based, it's whole person, it's wraparound, it's data-informed, and it's humanity-centered. And I think that the promise and possibilities of that new model with a system that is in dire need of its own intervention is promising. And so I really appreciate you investing in this. Thank you.
Thank you, Neville.
Yeah, absolutely. And Wyatt, promise you'll come back on the show in the not too distant future, bring somebody that has benefited from your services, bring in maybe a provider or a donor or anybody in that area, and we would love to have them on and talk about the great things you're doing.
Absolutely.
Absolutely.
And if anybody's experiencing mental health issues, don't forget there's a 988 number that you can always reach out to. So take that step if you need it.
Yeah, absolutely. Wyatt Hinshaw, what an absolute pleasure. Founder and CEO of Fundamental Health, joined by Neville Villamoria, Senior VP of Mission Fed Credit Union, joined by my co-host, Brandon Joe, co-founder of Treasure Hacks and the producer of the Spotlight on the Community Show. I'm Drew Schlosberg, and you've been listening to another edition of Drew Schlosberg Spotlight on the Community Show, the nation's longest-running community podcast, now in our 18th year, brought to you by the good folks of Mission Fed Credit Union, continuing to raise the bar and do great things for all of us living in San Diego County. We hope you enjoyed the show.
You've been listening to an episode of Drew Schlosberg's Spotlight on the Community Show, amplifying the voices of social impact organizations, entrepreneurs, local nonprofits, and other community champions who shape the culture, creativity, and connectivity of San Diego community. Brought to you by Mission Fed Credit Union, bringing good things to San Diego for over 60 years. Learn more about what is good for you and good for all by visiting www.missionfed.com.
Cloudcast Media.